ShareIn.biz, a place where small business owners and investors get to meet. Welcome to ShareIn.biz, a non-profit organization which finds investors for small businesses. Today we have Andronica joining us. She's going to tell us more about Phila Health. Phila Health is one of the businesses that's listed on ShareIn.biz. You can find the full investment pitch on the website, as well as an interview on the African Health Week and the introduction to the company. So Andronica is here to answer a few questions about Phila Health. Andronica, let's start with, what is Phila Health all about?
Hi, Jaco. Thank you for having me. Phila Health is a healthcare company that provides healthcare services to community-based people, which we use community-based healthcare workers to take care of all the community healthcare requirements, which are basic needs. It might be management of chronic illness, providing primary health care. What we have seen with Phila is getting into the market whereby primary health care costs are high, and Phila Health is trying to provide primary health care at affordable prices, and by also providing high quality healthcare services.
Why community health?
Why Phila decided to get into healthcare is there's a need for quality primary healthcare in the country. Right now, when you look at the division or the ratio of primary healthcare between public and private healthcare services, most people don't have medical aids, and people they need quality healthcare services. So Phila Health saw the niche in the market that we can do this, and also by providing quality healthcare services at a lower cost, and also not by only doing that, by also involving community healthcare workers to be of assistance to the community as itself. And we saw this model work in the Netherlands with the Bertzoch model. And we believe with Phila that this can work in South Africa, also to improve the healthcare services in the country.
Which equipment do you use?
Okay, we have portable backpacks or healthcare kits that is equipped with all the equipment or the tools that the primary healthcare workers need. So this enables them to conduct basic healthcare tests or screening. Might be for blood pressure or high blood pressure or cholesterol, BMI. So these kits are used by community care services, and Phila Health provides this. So each and every group has its own equipment that they use, and is combined with, like I said before, with the technology behind, for them to be able to also provide the results instantly.
What kind of tests and can you do with this medical equipment?
We can do a lot of tests, especially the ones that a normal patient will go and do in a public clinic or at a private hospital. It can be HIV test, it can be a high blood pressure test, it can be for diabetes. It's a number of tests that we do. And what is nice about this is we can, as we grow as Phila, we can add as many tests as we can, because we are all about being mobile. So we are building on our offering. We also offer a hearing test. We also looking at doing mental health care services in communities, which is something that is a key now when we look at what COVID has done, within during the past 2 years. And these are the things that we are offering currently, but our portfolio will grow as we grow as Phila.
What kind of healthcare services?
We cover chronic illness management. We have also primary health care that we provide and prenatal care. So anything that the community needs in terms of healthcare, that they usually will go to the local clinic to get a service on. Phila Health can offer the services. The reason being also, we've got old age people who can't always go to the clinics to get the services. So by using local community care healthcare service workers, that also alleviates the burden on the local clinics.
How do you manage these groups?
Each and every community has its own group, which is a small group, and they manage themselves. So what Phila Health is, it equips the community healthcare groups with equipment and the resources to provide the services. We are currently working on technology to facilitate the management of the community workers. By doing this, we feel that we can reach a larger groups or number of people around the country with the whole solution based on technology, not only looking at community-based workers services, but also incorporating it with technology, and which we think now is the key when it comes to providing services to key services in the country. Our aim is to empower the up-and-coming youth, also addressing unemployment in the country. So we will have one skilled or two skilled nurses, and then the rest will be learning from these professionals. And we hope by doing this, it's a good way of training and also upskilling communities.
Now, you said earlier, one of the focus points for Phila Health is provide this at an affordable rate. Now, how do you get it at an affordable rate?
Okay, so because we are not using a brick and mortar model, these community workers, they are community workers, and we have portable equipment that they can move around with. So it cuts most of the costs of a person going to a clinic or to a doctor. Although public healthcare services is free in the country, we still see that there is no quality service that the public healthcare service provides. So by us having mobile equipment that we can move around and not be fixed, and this equipment that we use are not that expensive, but they still provide the same services that you get when you go to the public clinic. So that cuts the price of healthcare services.
Let's talk about the investment. So you say you need 150,000 Rand. Tell us what you're going to do with that money.
We will invest, we will procure a mobile clinic, which we will equip with necessary equipment to provide additional services for, let's say, for hearing tests, for eye tests, and other additional services that the basic community-based worker can provide. So this will enable us to reach as many communities as we can, including the rural areas, and also enhancing the technology that we want to build on, which will help us to manage these community-based care workers to also manage themselves. And also the technology that we are building is to enable the community themselves to book services when they need services, and also that we can keep their records as well. We see now that data is key. For us to have a patient's record is very, very important. And I think this can be something that can enable us to maybe partner with the public sector in the long run, because we will have the patient's data, in terms of technology at the back end. Besides, it's equipment, yes, it's a mobile clinic. We also are building a technology behind this, which will enable us to make things easy, automate things, to help these healthcare workers to manage their groups. Because what Phila wants to do is to enable these community workers to be fully sufficient when it comes to how they manage communities, their records as well. So some of the money will go to improving our technology and building that technology that we need to be able to provide these services.
What do you need from an investor? I assume it's not only the money, but where do you want to take the business?
Okay, the kind of investor that we are looking into is somebody who has some background maybe in the healthcare sector, somebody who has passion in developing communities, and somebody who will be guiding us as well, and supporting us in this journey, and also wanting to see this grow with us. So it's somebody who we want the person who will also not really hands-on, but be of guidance to us. There's a lot of things that we want to do, and also we will need somebody who will be able to also give us advice on certain areas that maybe we might be lacking.
After an investor gets involved, where do you see the future of Phila?
If we get this investment, it will help us to grow quickly, because right now, what is a constraint for us as Phila now is getting equipment, is growing our team. So if we get the investment with that help, with the help of the investor, is within a year, we will want to have a presence. It's in all 9 provinces of South Africa. Maybe having more than 3 teams in each and every community, and then we'll grow further. And we don't know. We want to offer this to our neighboring countries as well in Africa. So the sky is the limit when it comes to this. I mean, health is a key area that we can't all avoid. It's a need. It's a necessity. Yeah.
Tell me about one of your customers.
Okay, when we started Phila, we did do some advertising on certain platforms, and we had one customer who was very interested in Phila's offering. And this might sound strange, but this was a company that reached out to us and say, hey, would like to have you do our wellness program. So we have done certain tests, medical screening with this company. And to our surprise, we are now going back for the 2nd year to provide services, because they have been so happy with our services. Just to give you a brief overview of what services we have provided. We did HIV tests, we did eye screening, we did hearing tests, we did just general medical screening. And it was a success because at the end of the day, they wanted their employees to be well because of the environment that they work in. And Phila Health has managed to offer these services. We have also offered the services to fitness and health groups in the townships, and we have done two sessions in the townships, and there was some kind of a buzz around it, but we need investment. We see that for us to be able to offer these services at a larger scale, we need investment to grow.
To end off our interview, I think, tell us about yourself. You are all in this business. This is what you do.
I'm a co-founder with other two founders within Phila. I mean, this is our passion, and we see this working. And we have been fortunate enough to have somebody who have seen our vision from Pulukisa. So I am very, very passionate about this subject. For me, it's all about, taking care of communities, improving healthcare services in the country. And every day when I read, an article about how, there's a struggle in healthcare, it gives me much hope that Phila can be able to, to offer these services. Yes, I'm all in, Yakub. I am all in
You inspire
with my
us.
two other co-founders.
That's very inspiring. We wish you all the best luck with finding investor. If you're an investor and you saw this interview and you are just as inspired, go on the website sharein.biz, schedule an interview, get to know this business, and maybe you can help to make a difference in the world.